Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Arif. May I know what brings you here today? Okay. Anything else? Okay. I'm really sorry to hear about it, Mr. Arif. I totally understand how a stressful situation would be for you. Is there anything else you would like to add? Okay, Mr. Arif, to better understand your condition, I would ask you a few questions. Is it okay with you? Thank you, Mr. Arif, for your cooperation. And can you tell me, do you have to pass urine more frequently these days? And do you have to rush to toilet to pass urine? And do you have to wake up at night to pass urine? And do you feel hesitancy to start urination? Have you noticed any weak or double urinary stream? Do you have to start and stop urinary stream? And do you have to strain to pass urine? Do you have feeling of incomplete emptying of a bladder after urine? Have you noticed any terminal dribbling? Okay. Are you bothered by these symptoms excessively? I'm very sorry to hear about it. Do you ever suffer from a sudden blockage of urine? Do you feel a pain or burning while passing urine? Have you noticed any blood in the urine? Any passage of a stone or history of a stone formation? How about your bowel habits? Are you constipated? Okay, Mr. Arif, can you tell me, do you have high blood sugars, high blood pressure? And do you have fever or pain or burning or urination? Okay, have you noticed a significant weight loss? Do you have any back pain, night sweats? Okay, Mr. Arif, I'll ask you a few personal questions. Is this okay with you? Thank you. Mr. Arif, do you smoke? Do you take alcohol? Okay. Have you undergone any surgical procedure and through your front passage or on tummy? Any past history of hospitalization? Okay. And can you tell me if any immediate family member are suffering from same symptoms? Okay, Mr. Arif, are you taking any medication regularly, like cough syrup or prescribed by doctor or over the counter? Okay, so Mr. Arif, can you tell me what is the impact of your symptoms on your daily life? Okay, are you worried about anything in particular? Okay. Okay, Mr. Arif, can you tell me if you have undergone any investigation so far? Have you visited any doctor prior to this appointment? Undergone any examination? Have you gone under, any procedure? Performed any, physical activity, extensive exercise, intense exercise? Okay. Okay, so Mr. Arif, what I have gathered from your information you shared with me is that most likely you are having a condition what we call in a medical terminology is benign prostatic hyperplasia. Do you know anything about benign prostatic hyperplasia? Shall I explain it to you? Okay, Mr. Arif, don't worry, I'm here to explain. Actually, there is a gland at the neck of a water bag which get enlarged and cause obstruction to urine flow. and since it's normal pattern in age more than 60 years, so nothing sinister, hence named benign prostatic hyperplasia. Is it clear till now? Should I repeat it again for you? Okay. So, Mr. Arif, I'll ask you, do you a few tests, okay? Is it okay with you? Okay, Mr. Arif. Here is midstream urine for blood glucose and microscopy for hematuria and culture and sensitivity, okay? And urea create and electrolytes with EGFR. And here is ultrasound for size of prostate gland and for residual volume. Is it okay with you? And one blood test, another blood test of serum PSA level, okay? And let me reassure you that as you have not lost weight and you do not have any back pain. Okay, so there is no sign of prostate cancer. Hence, I can safely reassure you that most likely your symptoms are due to simple enlargement of prostate gland and not due to the prostatic cancer. Okay, as your age is more than 60 years, so it's common. Okay, and benign prostatic enlargement can be managed with medical or surgical treatment. Is it okay with you? Okay, so Mr. Arif, before I offer you some medicine, I'll offer you to make some changes in your lifestyle. Will you do it for me? Thank you. So, Mr. Arif, I try to decrease evening intake of fluids. Okay, and can you decrease coffee or tea intake? And can you learn bladder retraining exercises from physiotherapist? I'll offer you I'll refer you to physiotherapist for specific exercises, okay, and they'll teach you how to do these exercises and they'll help you in your symptoms, okay. And can you try to avoid constipation by taking adequate fluids in the daytime and fiber and daily exercise? I really appreciate it. And now let's come to the pharmacological management into their treatment. So I'll offer you tablet Tamsuline 0.4 mg, okay. You have to take once daily and it shows its effect in day 2 weeks time, and patient relieved with his symptoms, okay. And this drug is worth giving a trial before resorting to surgical option, for which I'll refer you to the urologist, okay. Is it clear till now? Okay. And if God forbid, if the symptoms excessively bother you, then, and if your sleep is disturbed, they maybe will need a quick treatment from a urologist, okay. And I'll offer a surgical treatment, and that urologist will refer you, okay, will pass an instrument through your front passage and remove part of gland which is obstructing urine flow, okay. And this procedure is done under anesthesia, so they'll decide you should undergo which kind of anesthesia, okay. And is there anything else you would like to share with me today? Is everything clear till now? Should I repeat all again for you? Okay, Mr. Arif, here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Okay, I wish you a speedy recovery. Take good care of yourself. Bye-bye.